Emergency rooms are changing, not from anything medical, but in a new ban on turning ambulances away, even when they're overcrowding.
NBC 10 I-Team reporter Tamara Sakarczyk shows us what this means for patient care.
The sound of sirens no longer coming to a sudden stop as a new rule bans standard diversions in Rhode Island.
Something needed to be done.
A hospital would go on diversion when it was overwhelmed, redirecting ambulance traffic to other emergency rooms. South County Health Chief Operating Officer Dr. Anitra Galmore tells me the system wasn't working.
There would be more than one hospital that would go on diversion. And we would have to determine whether or not we would come off or stay on based on the needs of another facility. And you really can't anticipate what the acuity is in another organization. So there was a lot of back and forth.
It happened frequently. Data obtained by the I-Team shows over 1,000 diversions in 2021, over 1,100 in 2022, and 796 in 2023. Since July, there's only been one diversion, a power outage at Rhode Island Hospital that qualified as an internal disaster and therefore was allowed.
Have you guys noticed an increase in patients from ambulance traffic at the emergency room?
We have not. In fact, our ambulance traffic has basically stayed exactly the same.
Dr. Anthony Napoli is the vice chair of clinical affairs for Brown Emergency Medicine.
It's presumably leveled out the playing field and should stay that way.
But it's also a lever hospitals won't be able to pull if they do get overwhelmed. According to the Department of Health, data has shown an increased level of patient volume since standard diversion ended.
Does that concern you with the winter coming up?
Yeah, I mean, it's a concern that we always have to keep that in mind.
Kent Hospital's Dr. Darren Gerard tells me it has forced hospitals to reorganize.
We did an overhaul of our front-end process when patients check in. We have taken some hallway spaces and chair spaces for people with lower acuity and minor complaints. And we put a physician there to see the patients right away.
In turn, ER wait times have dropped. The most recent numbers show a 40-minute wait to see a provider at South County's emergency department, a 58-minute wait at Rhode Island Hospital, a 98-minute wait at Miriam Hospital, and a 47-minute wait at Kent County Hospital. Whether that'll change during flu season remains to be seen, but hospitals are optimistic.
Do you think that it could backfire?
I actually don't have any concerns. We actually were very supportive and helped champion moving in this direction. I think it is in the best interest of the patients and the community.
Hospitals can still go on partial diversion and internal disaster diversions under this new rule. We explain much more about that on our website, turnto10.com. For the NBC Tonight team, I'm Tamara Sakarczyk.